My name is Robert Trainer, and I was parking my car in the parking lot, and somebody dragged me in here and asked me if I wanted to try an experiment. Unbeknownst to me, that this experiment would have a profound effect on the way I was feeling. And there was some doctor here who couldn't speak English very well, but he seemed like a nice guy. And he wanted me to drink water a few times a day, so I figured I'd give it a try. He wanted to clean out my insides and said that would give me more energy, so I figured, what the heck, I didn't have anything else better to do. So here I've been now for about 7 or 8 days, and I've completely given up alcohol and drugs, and I'm finding that I'm very energetic most of the time. Most of my depression is gone. I'm much less violent than I used to be, and my libido has expanded quite a bit. So I have nothing but good things to say. Nothing but good things to say.
Robert, what is the nature of your medical problem, if you could share that with us?
Well, I was diagnosed by someone as having colon cancer in December.
How many months ago was that?
That was the December 23rd of '07.
So that's about 3 months ago.
Right. And I don't feel sick anymore. I had a surgery followed by another surgery because they screwed up on the first surgery, and I was very, very tired and debilitated, and it took me about a month to begin to feel capable of moving around. But I must say that since I've started this treatment, my energy level has grown double of what it was, and I was already recuperating quite a bit. So I feel much more positive and energized from doing this program.
What types of treatments did you have, and what kind of surgeries were done, if you can share that?
I had an intestinal blockage, and that was removed, and small amounts of my lymphatic system were removed, and that's it. And there was a small piece of my liver that was taken just to see if the cancer had spread to the liver. And then after they sewed me up, the stitches broke and the surgery got infected, so they had to open me up and give me what is called an ileostomy, which means they closed off temporarily my colon, and my elimination is through my small intestine, which is a great lifestyle change for me, considering that I was an athlete and a dancer, and I feel very encumbered by this.
Are you having any problems with the ileostomy in terms of not being able to keep food in your intestine long enough to maintain your weight?
Yes, constantly. Just have a constant flow, on top of the fact that the ileostomy appliance keeps breaking off in embarrassing situations, and it creates a lot of stress. So as soon as I can attach it, the better I will feel and start digesting normally.
What type of follow-up do your surgeons plan on doing in terms of evaluating where you are and where the cancer is?
Well, as far as I know, they weren't planning any until I got new surgeons, and I changed hospitals, and now the plan is next week I will have a PET scan and a CAT scan. I had a blood test this week, and based on those pictures, I will have to make a decision what I want to do, and so will they. They seem to feel if there's cancer in my body that I should do normal chemotherapy, but that decision hasn't been reached yet.
I see. And how many days have you been doing Dr. Kachatrian's protocol now?
I would say 8 or 9 days.
8 or 9 days. So you're not even halfway through the protocol, although almost halfway. And is it fair to say that you're feeling better, you're more energized, your appetite is good, your libido, you said, has improved?
Yeah.
And were there problems with sleep prior to this, and has that
Yeah, I
changed?
definitely had problems with sleep. My only thing I have to be careful is, because my energy level, I'm normally a person who's very active prior to my illness, is not to get too active too soon. Because I have such a renewed energy level, I have a tendency to be trying to do too much too soon. I have to monitor myself a little bit because my energy level is so extended now since I've been doing this.
From your ideal weight prior to getting the cancer, how much weight have you lost?
25 to 30 pounds. I was never fat, but I lost all muscle, basically. I was in very good physical condition. As a matter of fact, they wanted to take pictures of me at Gold's Gym in Venice, California, to show how good a condition I was in for my age, just before I got sick.
And as long as we're on that subject, what is your age?
63.
You don't look it.
Well, you should have seen me 3 months ago.
You're looking good.
Thank you. I've always taken care of myself. I would not have been a likely candidate by normal standards to get colon cancer. I've eaten well and lived a harmonious lifestyle. So it's been an interesting experience.
You never know.
Yeah. I feel a lot of it is emotionally based also, traumatically based. Something affected my spirit or my DNA from trauma.
Would you recommend Dr. Kachatrian's protocols on the brief amount that you've had so far to other people?
Yes, however, I would qualify that it is a commitment that not everybody is ready to make. In other words, you have to seriously be present and follow the protocol with regularity. It's not like just going into a doctor's office and spending 10 minutes there and taking a pill. It's a real engagement. So you do want to get well and do it and drink your water at the right time and be willing to have your cleanings and your enemas and et cetera, et cetera. So it's not just light and breezy. It's not painful or anything, but it does require a desire to do it.
And have you found the protocols terribly inconvenient or difficult to do, or not? And if so, what is the most difficult
Well,
part?
I have to drive 2 hours back and forth, so that's not bad. Fortunately, it's a nice drive, but it is a commitment. It was very challenging for me and very rewarding to clean my stoma, which is the portion of my intestine that was opened for elimination. And I think this is very, very healthy. And I had to go back into the hospital because I had a blockage in my intestine, and they had no idea about doing that. And it just makes so much sense to just clean the intestine. And it just seems so healthy to do that.
Have you been taking some of the probiotics that Dr. Kachatrian has provided?
Yes, that's another experience, and also another commitment to take the time to prepare it and do it. Since I want to get well, and I believe in what you guys are doing, I don't have a problem with that, but I don't know whether everybody would do it. It's not difficult, but you have to take the time to cook it a little bit and prepare it and drink it. But I've been doing it twice now. I've got a third batch brewing.
And how many times a day are you drinking the water that he provides you?
4 times.
And are you alternating waters
Yes.
between alkaline and acid?
Yes.
Okay. Are there any final comments you'd care to make?
Yes. I feel that when you go into a normal hospital or clinic, it's a very technical situation. And what I feel here is it's not only technical, but there's a feeling of care and healing, which you don't rarely would find in a normal hospital. And I believe that this is very important, this kind of kindness and care really contributes to healing, and it makes a big difference. It makes it a pleasure to come here rather than just sit in some cold clinic. And I think this is an integral aspect to healing that normal medicine doesn't understand.
Thank you, Robert.
You're welcome.
This is Dr. Schwartz. We've just concluded an interview with another one of our patients who has started Dr. Kachatrian's protocol. This patient has had metastatic colon cancer and has had 2 surgeries in that regard, including an ileostomy, as he mentioned. He had been losing a lot of weight, and the weight is still continuing to decline, primarily, we think, because the food is passing too quickly through his small intestine due to the surgery. Hopefully we'll be able to slow that down and allow some of that food to be absorbed. In almost every other area of functioning, he appears to be improving, in his own words. We have yet to see the results of the scan and of the tumor markers, and we look forward to interviewing him again in another week or 2 to see the results of those evaluations. Thank you. I am Dr. Alan Schwartz, and we're interviewing patients who have been using Dr. Kachatrian's protocol for improving general health. Our next client will be introducing himself, and we will ask questions regarding what he came for originally and what his expectations were and how he's done since starting the protocol. This should be close to the end of his tenure here during the 3-week period, and we will see whether he has improved or not, or had any side effects or other adverse reactions. So here's our next client who will be talking to you in just a moment.
Hello, I'm Robert Trainer. This is my second interview. When I left the office last week after getting the bacteria, I felt great. On my way home, I began to feel shivery, chills. And by the time I got home, I was very cold and in pain. And the pain predominated my lower back, although my joints and muscles felt sore. But the lower back was extremely painful. And I decided to call the clinic to find out if this was unusual or what was going on. And, I'm sorry?
Urina. Pee.
Mention the urine.
Oh, my urine was very, very dark. The night was terrifying for me. I have never experienced so much pain in my life. It lasted approximately 10 hours, the pain, predominantly in my lower back. The doctor did not want me to take Tylenol or other drugs that would reduce the fever or the pain, and explained to me that the idea was to allow whatever was happening to take its course. So I did that, and it was excruciating. The next day, I was totally out of sorts, and I canceled a series of tests that I was supposed to have at the hospital, a PET scan and a CAT scan, because I was unable to sustain it. And slowly over a period of 3 or 4 days, my symptoms began to subside. And by Monday, I felt great. I mean, perhaps better than I felt even before I was sick. And today I feel quite good as well. And I had my tests again today, and while they produced a fair amount of anxiety, I feel confident that I'm much healthier than I was in December when the last series of tests were taken. I feel that if there is any sign of cancer in me, it is greatly diminished. Of course, this is my own feeling about things, but I know I'm feeling much better, much more energized, much more positive. The only thing that is affecting me is my intestines, which are not connected. and it makes my lifestyle quite challenging because I do not assimilate food easily, and I am constantly eliminating, and it makes it difficult to gain weight. However, I am getting stronger every day, even though I haven't gained more than 3 or 4 pounds. Any questions? Or
Yes, what is your weight now compared to what it was at the start of the therapy?
I would say it's about the same,
About the same.
because I lost weight over the period that I was
Not feeling well.
Yeah,
And you gained some of that weight back, or
Yeah.
most of it back?
and I feel like I'm gaining, since I'm eating now much more solidly, I'm starting to gain. And I'm taking enzymes, which help.
Did you have any elevated cancer markers at any time?
I did.
And what was that cancer marker?
I believe I had 2. One was a C1999, is that-
CA19-9?
and one other
CEA?
CEA.
Were they both elevated?
Yes.
And did the doctors repeat those tests at any time, or will they be doing that?
Yes, they did. I don't know the results. I'll know on Tuesday. We repeated one of them, the C999,
1990?
and there was a change. There was a closer distance between the 2 lines of demarcation. So the score diminished, but also the lines,
You're talking about the reference range
range
seemed to change
changed. There was a difference
from the first time you did it?
Right.
And did the score go up, down, or stay about the
It
same?
went down.
It went down. But
Despite
the reference
change-
range also went down, so it was
No,
still
the reference
considered
range
elevated.
went up,
The reference range went up?
and the score went down despite that.
Okay.
Now, what that means, I don't know.
All right. Do you know what the score was out of your memory?
No, I don't.
Okay.
Robert, and
When
next,
was it? Go ahead.
and next day after pain, what the symptom you had? Diarrhea.
Headache, diarrhea, pain in the joints. That was more the 3rd day. Diarrhea and was more the 3rd day too, with a lot of gas and discomfort.
And how many days this discomfort? Long?
I would say 4 days.
4 days. And after then?
I always have some discomfort because of the intestinal problem, but it's much more regulated and much less gas pain.
You take drug or on any what your
No,
guys?
I take a sleeping pill.
Only.
Would you say that your experience with this protocol has been worthwhile? Yes? No? Not sure?
I would say absolutely.
Absolutely. And would you recommend others try this protocol?
Yes, some of that will also depend, some of my recommendation will depend upon whether there's a change of result in the tests that I've taken.
Absolutely.
But I would say that from a standpoint of energy and cleaning of your being, it's very worthwhile no matter what. And it's done in an atmosphere that's very supportive.
Thank you very much.
So I highly recommend that. Can you keep the camera on a second? Because in no medical situation that I've been in has anyone attended the very specific organic issues. For example, the cleansing of the colon or the cleansing of my stoma, which are all aspects of my intestines that need care, and nobody even considers that in a conventional medical environment. The idea of energizing and cleaning the small intestine. And they felt, well, if there's mucus or anything in my colon, don't worry about it. And this to me seemed rather small-minded. So from a hygienic standpoint, very significant. Plus the waters, what would you call it, the intensified waters definitely give you more energy and well-being, feeling of well-being.
That's good to hear. Thank you again.
Yeah, you're welcome. Thank you.
Again, I'm Dr. Alan Schwartz. This is another patient who has given us a summary of his experiences with Dr. Kachatrian's protocol. And as has been true of virtually almost everyone, with one exception, we've had just positive comments, usually halfway through and at the end of the protocol, which is again a 21-day protocol for most people. We look forward to interviewing Mr. Trainer again, perhaps in another week, and then maybe every few months thereafter. And we're definitely interested in knowing whether the cancer is diminished or perhaps even completely gone at this time. We look forward to seeing the lab results and the results of the PET CT scan, which was just taken recently, and we hope the results will be positive. Thank you. Hi, this is Dr. Alan Schwartz interviewing patient Robert Trainer. Robert just got discharged from the hospital, and he was there because of an obstruction of the small bowel secondary to a problem from the previous surgery that caused the obstruction. His bowel was found to be very healthy on surgery and was reanastomosed, so he no longer has the bag. During the hospitalization, which was about 3 weeks, he lost a lot of weight, and he was just discharged today. And here's Robert Trainer.
Could you want to ask me some questions? Or?
Yes, I'd like you to go over your experiences in the hospital and what was discovered while you were there.
Okay, I think most importantly, what was discovered when I was in the hospital was, firstly, my blood tests when I came into the hospital showed that I was very healthy, that my tissue was very healthy, and the relationship of white and red blood cells was very healthy, and that even though I was underweight, I was very healthy nutritionally. And I feel that the work that we did here contributed a great deal to that. Secondly, when they agreed to consider taking down my ostomy, they wanted to make sure that my intestines were healthy. First thing they did was they gave me a test of my colon with, it was an enema with dye, and it showed that my colon was very healthy. And this was very important, or else they would not have even considered doing the takedown of the ostomy. Excuse me if I'm not using the right medical terms. When they opened me up, they found that my intestines were extremely healthy. And I can only feel that the work that we did here over a little over 3 weeks really contributed to my health. Now, right now, I'm kind of tired. I went through a lot. I was actually in the hospital for 4 weeks, not for 3 weeks, and I wasn't able to eat. I was on IV the entire time, and I feel that the strength that I brought into the hospital that came from the work that we did here carried me through this, and I'm extremely grateful, and I'm back now to rebuild my strength. But I feel as if I ran a race and really did well, and the reserves that I had a lot to do with the work that we did here.
Did the doctors notice any evidence of cancer in your intestines when they did
None.
the surgery?
Completely cancer-free.
I understand there's still some evidence that you may have cancer or small amounts of it in the liver and in lymph nodes. Is that
That's
your
what they say.
understanding?
Yes. And they want me to do chemotherapy. I've talked with my doctor, Dr. Ross, who's my family doctor at UCLA, and I told him that I was coming back here to rebuild myself nutritionally, and that also you were doing alternative methods of cancer treatment, but I didn't go into detail as to what you do here. But he felt that it was very worthwhile for me to come back because I was so healthy, and he agreed to call Dr. Schwartz and discuss what you're doing here. And I felt it would be more appropriate for Dr. Schwartz to talk to Dr. Ross about what he does or what you guys are doing here than me, just because it's a sensitive issue. But I believe that Dr. Ross is very open-minded, and that it's possible that even if I do chemotherapy, we could work out a relationship between what we do here and what an oncologist, a normal oncologist might be doing. And that's my hope.
Do you know what oncological drugs they plan on using?
No, I had an oncologist who completely freaked me out when I was in the hospital and didn't even want me to have the surgery to have the blockage removed because he said it was cancer and that I was wasting my time. And I told my doctor that I don't want to deal with him and I'm going to get another oncologist who's more reasonable. And but first I have to get strong and let my intestines and my bowels heal before I do anything.
That oncologist was mistaken, as your obstruction wasn't due to the cancer, it was due to a dehiscence or some
Right.
scar tissue from the previous surgery.
But this guy was totally unreasonable, and I just, after my experiences here, I can't deal with people like that. I have to have somebody who understands
Someone's open-minded.
me. Yeah. So my hope is to work out a relationship that would be very symbiotic and not destructive to me, and would deal with whatever issues, both nutritionally and with the cancer.
When you talk to your oncologist, find out whether this chemotherapy is designed to just buy you some time or to actually cure the cancer. That's important for you to know. And if it's designed to buy you some time, how much time and at what cost?
The impression that I've gotten is that they feel that the therapy is very effective in eradicating the cancer completely.
Okay, that's good to hear.
And also that having cancer, colon cancer in the liver is not uncommon, and they know how to treat it. Whether this is true or not, I don't know.
They sometimes access the blood vessel that feeds the tumor and directly infuse a chemotherapeutic drug through that blood vessel into the tumor so that you get more selective killing and less systemic adverse effects. There are a number of remedies that can be given along with chemo and radiation that should protect your normal cells and may actually enhance the effectiveness of chemotherapy. We can go into that if you wish.
Yeah, no, that's definitely what I want to do. And I would appreciate if you discuss that with Dr. Ross, too. He's very open-minded.
That's good.
Yeah.
Another potential treatment is something called insulin-potentiated chemotherapy, which allows you to use very tiny amounts of a chemotherapeutic drug with presumably the same or increased effect. We can go into that approach also as an alternative,
Good.
if that's something you're interested in.
Well, my mind is open. I have the feeling that I should definitely consider chemo, but in balance with something else.
Thank you very much.
Thank you. Thank you both. Okay. This is Robert Trainer. 1 week ago, from yesterday, we filmed me the day I'd gotten out of the hospital after being in the hospital for 4 weeks, having surgery. And I'm back here now 8 days later, and doctor has informed me that I looked like a zombie the last time. So he wants to film me today and show the improvement that I've had from eating and drinking alkaline water and allowing my food to be assimilated because my digestion is now functioning very well. And again, I'd like to affirm that I believe the work that I did here with the doctor enabled me to have the operation successfully and has activated my colon and small intestine so that I am functioning on a digestive basis as well as ever. And I'm gaining weight slowly, but I'm feeling much better, and I believe that the doctor wanted to have me on tape just to show that I'm not a zombie. And I'm very optimistic. I just had another treatment, and next week I'll have another blood test, and we'll see what my condition is. and I am determined to continue my healing process.
Thank you.